The 20th and 21st centuries have witnessed a scale of human suffering almost unimaginable in their depth and breadth. From the dawn of the 1900s to the present day, humanity has faced relentless challenges that have tested our resilience and compassion. Hunger, war, and disease, these three horsemen of the apocalypse, have cast a long shadow over humanity. They have not only taken lives but have also disrupted societies, economies, and the very fabric of human existence. They have left an indelible mark on our collective memory. Memorials and monuments stand as silent witnesses to the pain and loss endured by countless individuals and communities. Millions upon millions of lives have been lost in the wake of these devastating forces. The sheer scale of the suffering is almost beyond comprehension, with entire generations affected by the ravages of war, famine, and disease. It is a grim reminder of the fragility of life and the ever-present potential for chaos. Natural disasters, too, have played their part, compounding the misery and highlighting our vulnerability to the forces of nature. The 20th century, in particular, was marked by unprecedented violence and suffering. The two world wars alone resulted in the deaths of tens of millions and left deep scars that are still felt today. Two world wars, countless smaller conflicts, and a host of other atrocities left the world reeling. The aftermath of these wars saw cities in ruins, economies shattered, and societies struggling to rebuild. The Spanish flu pandemic of 1918 swept across the globe. It was one of the deadliest pandemics in history, affecting people from all walks of life and leaving no corner of the world untouched. It infected an estimated 500 million people. Hospitals were overwhelmed, and the medical community struggled to cope with the sheer number of patients. It left a staggering death toll in its wake. Entire families were wiped out, and communities were left to mourn the loss of their loved ones. But war and disease weren't the only culprits. Famine, often exacerbated by political and economic factors, has also been a persistent threat to human life. From the Soviet famines to the Great Leap Forward in China, starvation claimed millions more lives. These man-made disasters were often the result of misguided policies and a lack of foresight. These man-made disasters exposed the deep inequalities and systemic failures that plague our world. They highlighted the stark contrast between the haves and the have-nots, and the dire consequences of neglecting the most vulnerable. These events, as tragic as they are, offer a stark reminder of the interconnectedness of our world. In times of crisis, the actions of one nation can have far-reaching effects on others, underscoring the need for global cooperation. They highlight the urgent need for peace, sustainability, and global cooperation. The challenges we face today, from climate change to social inequality, require a united effort to overcome. In a world increasingly facing new challenges, understanding the lessons of the past is more critical than ever. By studying history, we can learn from our mistakes and strive to create a better future. We must learn from the mistakes of history to build a more just and equitable future for all. It is only through understanding and cooperation that we can hope to prevent the suffering of the past from repeating itself. Hunger, a silent and insidious killer, has plagued humanity for centuries. It lurks in the shadows, often invisible to those who are fortunate enough to have never experienced it firsthand. Yet, for millions, it is a daily reality, a relentless struggle for survival. But the 20th and 21st centuries have seen hunger reach an unprecedented scale, with millions suffering from malnutrition and starvation. The modern world, with all its technological advancements and wealth, still grapples with this age-old problem. The causes are complex and interwoven. War disrupts food production and distribution networks. Conflicts force people to flee their homes, leaving behind their livelihoods and plunging them into uncertainty and hunger. Poverty traps families in a cycle of food insecurity. Without the means to buy or grow food, they are left vulnerable to the slightest economic or environmental shock. This cycle is difficult to break and often spans generations. Climate change brings unpredictable weather patterns and threatens crop yields. Droughts, floods, and storms can wipe out entire harvests, leaving communities without food and farmers without income. The statistics are staggering. According to the United Nations, over 820 million people worldwide suffer from chronic hunger. This number is a stark reminder of the scale of the problem we face. That's more than the combined populations of the United States, Canada, and the European Union. Imagine entire nations living in a state of perpetual hunger. Every year, millions die from hunger-related causes, many of them children. These are preventable deaths, a tragic consequence of our failure to address the root causes of hunger. The human cost of hunger is immeasurable. It is not just about the physical pain of an empty stomach, but the emotional and psychological toll it takes on individuals and communities. It robs individuals of their health, their potential, and their dignity. Malnutrition stunts growth, impairs cognitive development, and weakens the immune system, making people more susceptible to diseases. It perpetuates poverty and instability, hindering economic growth and social progress. Communities trapped in hunger cannot thrive and nations cannot develop. Despite the grim statistics, there is hope. Around the world, countless individuals and organizations are dedicated to fighting hunger and making a difference. Organizations like the World Food Programme, along with countless NGOs and individuals, are working tirelessly to combat hunger. Their efforts range from emergency food aid to long-term solutions aimed at building food security. From emergency food aid to sustainable agriculture initiatives, these efforts are making a difference in the lives of millions. They provide not just food, but hope and the possibility of a better future. But the fight against hunger is far from over. It requires a concerted effort from all sectors of society, including governments, businesses, and individuals. It demands a sustained global effort to address the root causes of food insecurity and ensure that everyone has access to the nutrition they need to survive and thrive. Only then can we hope to eradicate hunger and build a world where no one goes to bed hungry. War, the most visible and brutal manifestation of human conflict, has left an indelible scar on the 20th and 21st centuries. From the trenches of World War I to the battlefields of the Middle East, millions have perished in the name of ideology, power, and greed. The statistics are staggering, painting a grim picture of humanity's capacity for violence. World War I, the war to end all wars, claimed an estimated 40 million lives. World War II, even more devastating, resulted in the deaths of between 70 and 85 million people. These conflicts, along with countless smaller wars and civil wars, have left a legacy of trauma, displacement, and destruction that continues to reverberate today. Beyond the battlefield, war's impact extends far wider. It disrupts economies, shatters infrastructure, and fuels humanitarian crises. The displacement of civilians, often numbering in the millions, creates refugee crises and strains resources. The psychological scars of war, both on individuals and societies, can take generations to heal. Despite the horrors of war, the pursuit of peace remains a constant struggle. Diplomatic efforts, international organizations, and grassroots movements all play a role in preventing future conflicts and promoting reconciliation. Disease, an invisible enemy that knows no borders, has been a constant threat to humanity throughout history. From the earliest recorded plagues to modern-day pandemics, infectious diseases have shaped the course of human civilization, altering societies and economies in profound ways. But the 20th and 21st centuries have seen the emergence of new and deadly diseases, as well as the resurgence of old foes. The rapid pace of globalization, urbanization, and environmental changes have created conditions ripe for the spread of infectious diseases, making it more challenging to contain outbreaks. From the Spanish flu pandemic to the HIV/AIDS crisis to the COVID-19 pandemic, infectious diseases have claimed millions of lives and tested our resilience. Each of these pandemics brought unique challenges and required unprecedented global cooperation to combat. The Spanish flu of 1918, one of the deadliest pandemics in history, infected an estimated 500 million people worldwide, killing between 50 and 100 million. This pandemic overwhelmed healthcare systems and led to significant social and economic disruptions, highlighting the need for better preparedness and response strategies. The HIV/AIDS epidemic, which emerged in the 1980s, has claimed over 35 million lives and continues to be a major global health crisis. Despite significant advances in treatment and prevention, stigma and discrimination remain significant barriers to addressing this epidemic effectively. The COVID-19 pandemic, which began in 2019, has caused widespread illness, death, and economic disruption. It has exposed vulnerabilities in healthcare systems and underscored the importance of global solidarity and cooperation in addressing public health emergencies. Beyond these high-profile pandemics, countless other infectious diseases, such as tuberculosis, malaria, and measles, continue to plague communities around the world, particularly in low-income countries. These diseases often receive less attention but have devastating impacts on affected populations, perpetuating cycles of poverty and illness. The fight against disease is a constant battle. Researchers and healthcare workers tirelessly work to develop new treatments, vaccines, and public health strategies to combat these ever-evolving threats. Their efforts have saved countless lives and improved the quality of life for millions. Advances in medicine, public health initiatives, and global cooperation have led to significant progress in preventing and treating diseases. Vaccination campaigns, improved sanitation, and better access to healthcare have all contributed to the decline of many infectious diseases. However, challenges remain, including antimicrobial resistance, emerging infectious diseases, and inequities in access to healthcare. Addressing these issues requires sustained investment in research, healthcare infrastructure, and international collaboration to ensure that all communities can benefit from advances in medical science and public health.